My name is Lauren Stanley, and today I'm going to be doing a intramuscular injection. So first I'm going to check my order. It's for ceftriaxone, 1,000 milligrams per 3 milliliters. So before I enter the medication room, I'm just going to go ahead and check the MAR for the 5 rights, the right patient, drug, dose, route, and time. So after I've verified all that, I'm going to go ahead and go to the medication room. The medication I'm doing is ceftriaxone. It's 1,000 milligrams per 3 milliliters. So I'm just going to go ahead and perform hand hygiene and put my gloves on. I'm going to open up an alcohol pad and I'm going to clean the top of the vial and discard that. And while that's drying, I'm just going to go ahead and get my syringe, my needle. And I'm going to uncap it. So after this is done drying, I'm just going to go ahead and pull out 3 milliliters of air from my order. I'm going to go ahead and inject that in. Okay, after that's done, I'm just going to go ahead and pull 3 milliliters out. Okay. So I'm going to go ahead and get the bubbles out. And once that is done, I'm just going to go ahead and recap it. And I'm going to go ahead and take my gloves off. After that, I'm going to go ahead and go to the patient's room, but first I'm going to, once again at the bedside, check the MAR, make sure that the 5 rights match up, and I'm going to go ahead and check that this is the right medication and the right amount. So now that I'm in the patient's room, I'm going to perform hand hygiene again, put on a new pair of gloves. Okay. I'm going to go ahead and assess the skin for any edema, rashes, or breaks in the skin, anything abnormal. And since I don't see any, I'm going to go ahead and get a new alcohol wipe, and I'm going to wipe the skin from the innermost part to the outermost. I'm going to go ahead and discard that. Next, I'm going to go ahead and uncap my needle. And for an IM injection, I am going to perform this at a 90-degree angle. So I'm going to hold it for just a second. Okay, now I'm going to go ahead and recap my needle and discarded that in the sharps container. If there was any bleeding, I would go ahead and dab it with a cotton ball, but since I don't see any, I'm just going to go ahead and assess the skin for any adverse reactions or anything like that. And I don't see any, so I think we are good to go, and that is how you do an intramuscular injection.